So the most inferior of the deep six lateral hip rotators is quadratus femoris. That's the muscle we're going to release now. It sits right here. And we're going to use SMRT to do that, spontaneous muscle release technique. So that muscle is a little bit of a square rectangle. It sits between the ischial tuberosity and the femur just medial to the greater trochanter. So we can release that muscle in a couple of different ways. This is going to be our monitor right in here. I'm going to move that for a second so that we can see. I want to take her ischial tuberosity and I want to draw it out lateral toward the femur. So I'm just going to pull it out toward the femur. So to do that, I'm actually going to go to the medial aspect of that ischial tuberosity. So I'm on the inferior aspect, and then I'm going to move over a little bit so I'm just on the medial line. And I'm going to draw that ischial tuberosity toward the femur. That's going to shorten that muscle. I can bring my other hand in and monitor. Okay, so that's one way that we can release this. Another way that we can do this is we can come to the outside of the femur just below the greater trochanter, and we can roll it into lateral rotation and then push into a little bit of adduction, adduction. Okay, so this is my monitor hand again. I'm using the back of my hand and I'm just anterior to that proximal femur and I'm just rolling it into lateral rotation and then just pushing into a little bit of adduction. So that's another way that we can release quadratus femoris. Can we do both of those together? We could do that. Let's move that ischial tuberosity lateral. And I'm going to take the femur, I'm going to move it into lateral rotation and into adduction a little bit. That is a nice release for quadratus femoris. So the obvious question here is, well, if you can do both, why would you not do both? Well, on Jen, this left ischial tuberosity is actually shifted medial. So when I pull it lateral, it doesn't really like that movement. So I might only want to use the femur on her and move the femur into lateral rotation and adduction. That's going to give me a better release on Jen because that's the movement that she actually needs. Sometimes the ischial tuberosity is really pulled lateral, but so is the femur. So the femur might be sitting in abduction. So when we try to move it into adduction, it's actually fighting us. So in that case, we only want to use the move from the ischial tuberosity. And then there are times when somebody's femur is rolled into lateral rotation, it's pushed a little posterior, and then the ischial tuberosity is pulled out lateral. Using both moves gives them intense relief. So try one, try both. Look for videos that tell you about the anatomy of quadratus femoris and how to strengthen that muscle and how to lengthen that muscle.